The Newsday continues here on One News Now. I'm Sean Yao. OCTA research claims that Metro Manila is now at low risk for COVID-19, contrary to the assessment of the Health Department. The research group reported that weekly average cases in the NCR have gone down to just 900 from over 1,400 in the last week. They also saw the positivity rate decreasing to 6% and the reproduction rate dipping to 0.46. The DOH previously classified the capital region and 5 other areas in the country under moderate risk status. And the DOST has released preliminary results of its studies on virgin coconut oil and lagundi as alternatives for people with mild and asymptomatic COVID-19 symptoms. Jen Calimon with the details.
Mild and asymptomatic COVID-19 patients now have a more accessible and affordable alternative to counter their symptoms. This is after the Science and Technology Department shared positive preliminary results in its clinical trials on virgin coconut oil and lagundi. After months of research, preliminary results by the DOST's Food and Nutrition Research Institute showed that virgin coconut oil can decrease the virus by 60 to 90%. This is based on in vitro trials of VCO in Singapore and community trials here in the country. 57 individuals took 0.6 milliliters per kilogram of VCO for 1 to 3 days and 1.2 ml per kilogram for 4 to 28 days.
For the VCO group, the relief from COVID-19 symptoms in the VCO group was already at day 18, meaning to say completely healed. Compared to the control group, this was experienced on day 23 only. So the recovery is really very fast and faster in the VCO group.
Trials conducted by the UPPGH on patients with high viral load and were hospitalized showed no significant changes. 77 hospitalized patients were given 15 ml of VCO 3 times a day for 14 days.
We did not see a significant difference in terms of the duration of hospital stay and in the time to resolution of symptoms.
The preliminary results of lagundi trials were almost the same as that of the VCO ones. The study showed that lagundi tablets and syrups can also alleviate the overall symptoms of COVID-19 for mild patients and those with no comorbidities. It also showed faster recovery for people with anosmia or those who lost their sense of smell. Experts said those who can easily access lagundi may take it, although it's best to still use the standardized formulation to get the precise dosage needed. Stage 1 of the trials showed that a dosage of 600 milligrams to 1.2 grams is safe and effective. They also assured that VCO and lagundi are safe for the consumption among children as long as it's the right dosage.
It's very safe for children. We've used it in the past for cough, for asthma, for COVID-19.
Despite these results, experts said these are not exactly the cure for COVID-19. The DOST will submit these results to the Food and Drug Administration to update its certification for VCO and lagundi. Reporting for News 5, Jen Calimon, We Are One News.
Let's check in on some of the election-related stories we're watching today. Presidential aspirant Bongbong Marcos wants the Philippines to become the next logistics powerhouse in Asia. Marcos said he is planning to modernize existing seaports, airports, and railways, as well as increase accessibility to other gateways. Marcos says this will raise the country's import and export capacity and provide opportunities for local industries to recover. Manila Mayor Isko Moreno is urging the IATF to file cases against DENR officials for reopening the Dolomite Beach without approval from the city government. In a TV interview, Mayor Moreno said the reopening of the artificial beach had not been properly coordinated with city officials. Moreno also noted that the DENR is currently in control of the Manila Bay area amid the ongoing rehabilitation efforts. And the PDP-Laban faction led by Energy Secretary Alfonso Cusi has signed an alliance agreement with Reform Party for the 2022 elections. The group said that the Reform Party will help campaign for Senator Bongo, who will be running as vice president in next year's polls. Former Philippine Navy officer James Layug, who was involved in the Oakwood mutiny, is heading the Reform Party. The Health Department reports nearly 4,400 fresh COVID-19 infections today. This brings the country's caseload to 2,765,000, some 53,000 of which are still active. COVID-19 deaths have reached the 42,000 mark, with at least 135 more patients succumbing to the disease. Meanwhile, recoveries are approaching 2.7 million after over 8,400 people were removed from the sick list. And 8% out of more than 35,200 recently tested for COVID-19 returned positive results. COVID-19 autopsies play a crucial part in determining the extent of the damage that the virus has caused the deceased. More in this Bloomberg Quick Take.
Even though it's glamorous on television, in reality, not many people want to spend money on dead people. Autopsy pathology is so important when it comes to COVID, because essentially it's a novel presentation, and I mean that's what autopsy pathology is built for. It's built for sort of finding these things out and looking for yourself and determining how the virus is affecting different organ systems. The autopsy is the perfect way to actually look at all body systems to see how it's affecting not just the lungs, which is the thing that most people think about, but the microvascular changes and how it kind of leads to stroke and in venous thrombosis and a whole spectrum of things. And when it comes to new variants as well, that's the question that we have to ask ourselves: that are the new viral variants, are they causing a different pattern of microvascular disease, for example? So that's why autopsying these patients, in my view, is really important if you can do so safely, and I believe that we can. The contribution of the actual viral infection to their death might be vastly different in some people. The COVID infection is only one part of a number of factors which has resulted in them dying. And often it's not clear without an autopsy what is the primary operative factor in some of those more subtle cases. I think some of the misconceptions are that we can always come up with a cause of death straight away and everything kind of happens quickly and that everything is black and white. There's lots of tests that need to be done and you need to consider the balance of all of those things. And sometimes you might not be able to say what the very precise thing that caused that person's death is. I think probably one of the other misconceptions is that we can always determine a cause of death. We have a category of autopsies which the cause of death will be undetermined after we've done extensive investigations. The COVID autopsies that we've done here, one will take an hour. Obviously, we're sort of wearing sort of full PPE and bits and pieces. Sometimes that just makes things take a wee bit longer. But the autopsy bit of itself, that's only the first part, really. The histology reporting, for example, the work that's been done in the micro lab to sort of confirm the infection and whether we can not just identify the virus in nasopharyngeal swab, but also in lung tissue and other specimens. That kind of hour is only kind of the tip of the iceberg, really. There's lots of other things that need to be done before the whole thing's complete.
Let's take a quick look at today's other top stories. President Duterte has called on LGUs to devise a more systematic way of identifying unvaccinated individuals in their areas. The president threatened to dismiss or suspend local officials in LGUs with poor vaccination turnout. Nearly 26 million people have been fully vaccinated against COVID-19 as of October 25. That's over half of the 50 million target by the end of the year. The Ombudsman has junked graft complaints against former Transport Undersecretary Cesar Chavez and Light Rail Transit Authority spokesman Hernando Cabrera for lack of evidence. This is still in connection with the alleged non-payment of 1.9 billion pesos to Busan Universal Rail for maintenance services of the MRT-3. The DOTR terminated its contract with a maintenance service provider after a series of glitches back in 2017. And in sports, the Philippine Sports Commission has approved 750,000 pesos worth of special incentives for Carlos Yulo. This is for his double medal performance at this year's World Artistic Gymnastics Championships in Japan. PSC Chairman Butch Ramirez said the annual tilt is not covered by the law granting incentives to winning athletes. However, the commission decided to grant this reward to Yulo nonetheless. For more updates, visit News 5, The Philippine Star, and Business World online. Visit our website, onenews.ph, for more in-depth analysis. You can also catch One News on the Signal Play app. Register for a free account at www.signalplay.com and stream One News live anytime, anywhere. Masks on, wash hands, and stay safe, Philippines. I am Sean Yao. We are One News.